So a neck lift is something that can be performed in isolation or more commonly will complement a facelift. And this is really for patients with a lot of laxity and a lot of fullness in this area under their neck, especially in an older population that's not a good candidate for liposuction alone. And so a facelift needs to be performed under general anesthesia, so you do need to go to sleep for it. So anytime you go to sleep under a general anesthetic, there's a very small risk of something serious happening, like a heart attack, a stroke, but in an otherwise healthy person, that should be extremely small risk. So for a neck lift, we make an incision about 2 to 3 centimeters just under the chin, and we open up the space, and we do several things in that area. We remove some fat, we often contour the glands, the saliva glands, as well as some of the muscles there. In addition, we sew together the two heads of a muscle called platysma, and that makes part of a sling. And as part of the facelift part of the operation, we tuck the other side of the platysma up under the jawline to give you a nice defined jawline. Anytime you make an incision, risk of scarring, risk of infection, you get quite a bit of numbness. Again, I use my 3-finger rule under your chin, and that numbness recedes after 1 month, 2 months, 3 months, with most patients getting a complete resolution of that numbness. There's a little branch of the facial nerve that goes to your lower lip muscles, that comes down over the jaw and is really in the area of that we're working, especially when we're removing part of these salivary glands to recontour the neck. Most times, a little weakness to the lower lip is temporary. Very rarely, much less than 1%, that can be a permanent injury. Anytime you open up a space, there's a small risk of bleeding into the skin that we sometimes need to address. But most times we see you on the first day after surgery. We remove your neck drains. We see you at 1 week and we remove your stitches here. And if you've had a facelift, we remove your stitches around the ear. Everyone has some swelling and bruising that lasts about 2 to 3 weeks. But at 1 month, people are looking very good. And at 3 months, they're looking extremely good.